Hello, everybody, and welcome to HonestHealthcareSolutions.com. My name is Evelyn Soriano, and I want to thank you for your interest in learning more about what Medicare is and what your options are. First, I want to ask you a question. Who here thinks Medicare is confusing? Yes, and I agree 100%. But here I will try to explain it in a way that will make it easy for you to understand. If you have any questions, please feel free to pause this video so you may go grab a pen and paper to write down your questions, and I will be more than happy to answer any of your questions once you have completed watching the video. But we have a lot to cover, so let's get started. Does anyone remember when Medicare first started? In 1965, so it has been around for a while as a great program to provide health insurance coverage for seniors. A lot of people think that Medicare covers 100% of your healthcare needs, but unfortunately, that is not the case. Medicare does not cover everything, so some responsibility falls on you for your healthcare costs. Does anyone think the government is looking to provide more coverage or less? I think less. And even back in 1935, when the Social Security Act was signed into law, the president made a profound statement that said, and I quote, "We, the government, can never insure 100% of the population against 100% of the hazards and vicissitudes of life." So the government's intention was for Social Security to supplement retirement income, but for many, that is all they rely on. The same is true for Medicare. It is a great program, and although many people, when they just turn 65, think that Medicare will cover them 100%, it does not. So some of the cost is passed on to you, and here I will go through what that is and how to cover it with the most affordable options. A little bit about the history. Here I want to explain one of the most significant changes that happened in Medicare since its inception in 1965. In 1983, they came up with the prospective payment system, which changed the way Medicare paid claims. I want to focus on the prospective payment system because it made a huge impact in terms of care. Before 1983, a patient stayed in the hospital until they got better and then would be released. However, that was very costly for Medicare and had the potential for a lot of fraud. For this reason, they went into a fee-based system that would pay specific amounts for specific amount of time based on 542 conditions known as DRGs, or diagnostic related groups. So if you were to go in the hospital after suffering a stroke, for example, the hospital would look up what Medicare will cover for a stroke and see 3 days. If the patient is not better after 3 days, they release them to recover somewhere else, either at a rehab center or possibly at home. That is where they coined the term patients are being discharged quicker and sicker. Anybody's heard of that phrase before? Well, that is where it came from. You become eligible for Medicare when you turn 65, or if you are under 65 because of disability or having end-stage renal disease. You must be a U.S. citizen or permanent resident for at least 5 years. There are 4 different times when you are eligible to enroll in Medicare, and it will depend on your situation. If you are just turning 65, you would be eligible for your initial enrollment period, or IEP. This is a beneficiary's opportunity to enroll into a Medicare plan when they first turn 65. This special election starts 3 months before your 65th birthday, the month of your birthday, and the 3 months after, for a total of 7 months. I know that 7 months seems like a long time, but I would recommend that you enroll as soon as the first 3 months start because you want to give the Social Security office enough time to process your application and mail the Medicare card to you. In some occasions, they will need additional information such as a copy of your Social Security card or passport, so that will definitely delay the process. Your Medicare usually will become effective the first day of your birthday month. For example, if your birthday is on November 25th, then your Medicare will start on November 1st. So call me as soon as you receive your Medicare card so we can determine what extra benefits you will qualify for. AEP takes place during October 15 to December 7. Every year, Medicare beneficiaries can reevaluate during this time and choose a different Advantage plan or disenroll and go back to original Medicare. All changes during this time will have an effective date on January 1st of the next year. OEP takes place from January 1st to March 31st. Medicare beneficiaries are allowed one opportunity to switch their Medicare Advantage plan or MA-only plan or disenrollment from their Advantage plan and go back to original Medicare. Other SEP, which is special enrollment periods, can take place when a Medicare beneficiary, for example, has a low-income subsidy, Medi-Cal, if they qualify for a special needs plan, if they move outside of the coverage area, if they lose employer coverage, if their plan is no longer available in their county, and a few more. It's important to enroll in Medicare when you're first eligible. If you don't, you may have to pay the following penalties. For Medicare Part A, your monthly premium, if you have one, may increase by 10% per year for twice the number of years you could have had Part A but didn't sign up. Medicare Part B, your monthly premium may increase 10% for each 12-month period that you could have had Part B but didn't sign up. You'll have to pay this penalty for as long as you have Part B. So it is important that you sign up with Medicare as soon as you are eligible so that you don't incur this penalty. This penalty is not just 1 month or 1 year. It stays with you for a lifetime, and you will have to pay an additional fee on top of the $144 that everybody's paying this year in 2020 for Part B monthly premium. You would have to pay on top of that an additional 10% every year for the rest of the time that you have Medicare. Medicare Part D, if you don't sign up when you're first eligible, you may have to pay this penalty for as long as you enroll in Part D, and it may increase every year. You may not have to pay if you receive extra help, or you can provide proof of other credible coverage. Medicare has two parts that government provides, Part A and Part B. Part A covers hospital coverage and Part B covers doctor and outpatient services. This is what the Medicare card looks like, and if you are turning 65 soon and never seen one before, know that it is not a plastic card. It is actually a cardboard card that comes attached to a postcard inside a Social Security envelope. So please don't miss it or discard it, and call me as soon as you receive it. Let's look at what Part A covers. Part A covers inpatient hospitalization, skilled nursing care, home health care, and hospice care. Most people do not pay for Part A by virtue of paying into Social Security for at least 10 years or 40 quarters. Some people have to pay a premium for Part A if they or their spouse did not have enough quarters. Others who are considered low income might not have to pay, but you need to qualify based on your income. If you think you are low income and would like to know if you are able to qualify, please contact me after this video and I will be able to help you turn in an application. Now comes the fun part. I will go through how Part A works and what your risk is. Part A has a deductible for inpatient hospital stays. The deductible started at $40 back in 1966. This year, for 2020, it has gone up to $1,408 per benefit period. That deductible will cover you for days 1 to 60. So whenever you are in the hospital for 1 night or 30 nights, you would be covered by that deductible. Please note, that is not an annual deductible. It is a benefit period deductible, which means that you could end up paying it up to 5 times per year. It resets once you are out of the hospital for 60 consecutive days. So if you were in and out of the hospital every 60 days, you could pay it multiple times a year. After day 60, it converts to a $352 copay per day for the next 30 days. If you have accumulated more than 60 days in the hospital in a year period of time, you would pay the $352 for days 61 to 90, which would end up costing a total of $10,560 for that 30-day period. After 90 days, Medicare provides 60 additional days of coverage called lifetime reserve days. Once those days are used, however, they are gone. They come with a hefty cost as well of $704 per day. If you are in the hospital for 100 days in 1 year, you would have used 10 days out of your lifetime reserve allotment. You would only have 50 days remaining the next subsequent years. Next is the skilled nursing facility coverage. Medicare covers a maximum of 100 days in a skilled nursing facility each year. The first 20 days are covered at no cost to the patient. Days 21 to 100 would incur a $176 copay each day. Not too many patients end up spending more than 20 days in a facility because they usually only keep you there until you have recovered enough to go home to finish recovering or move you to a rehab center. Now let's move on to Part B of Medicare. Part B is what covers your doctor's visits, surgeon's fees, ambulance rides, ER, urgent care, and radiology lab work, among other things. The typical premium for Part B in 2020 is $144.60 per month, and it is usually deducted right out of your Social Security check. But this amount might change every couple of years by Medicare. Some people may not pay anything due to their limited income. So if you have limited income, please call me and I will make sure we enroll you in a program by the state that returns that $144.60 back into your Social Security check every month. So individuals with higher incomes could pay more than the standard premium. Part B has a deductible as well, but it is an annual deductible, so you only pay it once per year. For 2020, it is $198, and after the deductible has been met, you would be responsible for 20% of the Medicare approved amount, which helps keep costs reasonable for most services. The approved amount is called Medicare assignment. If a doctor accepts Medicare's approved charge, they agree to accept by assignment. As you can see in 2017, of the billion claims submitted to Medicare, 99.3% were accepted by assignment. Obviously, most doctors accept assignment. If a doctor does not accept Medicare assignment, then they are allowed to charge the patient an additional 15% of the approved charge. As you can see, Medicare has some substantial expenses and out-of-pocket risk. The biggest being the fact that there is no stop loss of maximum out-of-pocket for you. So the 20% can be in tens of thousands of dollars of expense. There are two options we will be discussing to help provide more coverage and reduce that overall risk. The first option is the Medicare Supplement, also known as Medigap, which has been around since Medicare started. This option, a lot of people confuse it and call it PPO plan, and although they are not PPO plans, they work similarly only in the way that you are able to go see any doctor in the nation as long as they accept Medicare. However, these Medigap plans do have a premium, and when you are just turning 65 years old, the premium might start at around $100 to $130 per month, depending on the plan you choose. That is in addition to the Part B premium of $144.60 that most people pay, unless you are considered low income or pay extra if your income is higher than $87,000 per year. Medigap plans do not include coverage for prescription drugs, so you will need to also purchase a Part D plan to cover your prescription drugs, and those can cost anywhere from $20 to $100 per month depending on how much medicine you take and how much coverage you need. The second option is Medicare Advantage Plan. It is offered by private companies and it combines Part A and Part B in one single plan. Most Advantage plans include Part D prescription drugs, coverage, and additional benefits that are not provided by the original Medicare. Most Advantage plans here in Los Angeles are usually zero monthly premium, but they are HMO plans, which means that you will need to choose a primary care physician and they will refer you to any specialist that you can go see within a list of doctors that are in the network of the plan. Now let's take a look at both options. Option number 1 involves staying on original Medicare as the primary payer and adding an additional supplement to pick up most or all of the out-of-pocket expenses for Part A and Part B of Medicare. There are various plans available from A through N. The most comprehensive plan that covers 100% after Medicare pays is Plan F. Other good options that have lower premiums but still have great coverage are Plan G and N. These plans have an additional premium depending on age and possibly health condition if applying outside of a guarantee issue period. With this option, Medicare pays first and the supplement pays second. There is no drug plan included in original Medicare or the Medigap supplement plan, so one can be added by applying for a Part D of Medicare, also known as prescription drug plan. As mentioned, supplements do not cover Part D. Medicare Part D provides the prescription drug benefit for those eligible for Medicare. It is a separate part of Medicare and only available through private insurance companies that have been approved by Medicare to offer a drug plan. All companies have to follow a standard model for coverage, but can improve upon it for an additional premium. There are many drug plans available from many companies, and there can be big differences in premium, deductibles, and copays from one plan to another. We are able to compare all available plans based on the prescription drugs you use and the pharmacy you want and make sure you are getting the plan that is right for you. If you do not enroll in a Part D drug plan when you are first eligible for Medicare, you may have a late enrollment penalty if you ever try to add it later, unless you had other creditable coverage, like employer coverage or VA benefits. As you can see from this chart, these are the various stages of the Medicare drug plan that all companies follow. In stage 1, you pay the full amount of your drug costs until you have met the deductible on the plan, if there is one. The maximum deductible allowed by Medicare in 2020 is $435. That goes up slightly each year. The second stage is where you pay copays for your prescriptions, usually broken down by drug tiers based on cost. The copays are supposed to be equivalent to 75-25 split between the insurance company and you, the beneficiary. During the first two stages, the total drug cost is being added up each month, and once that total reaches $4,020, you would move on to stage 3. The coverage gap, also known as the donut hole period. During this stage, you pay 25% of generic drug costs, while the insurance company covers the other 75%. For brand name drugs, the manufacturer covers 70% of the cost, the insurance company covers 5%, and you would cover the remaining 25%. You pay this 25% until your annual out-of-pocket expense has reached $6,350, but that also includes the 70% paid by the manufacturers, so that will help reduce the net amount of out-of-pocket. Once the $6,350 threshold has been met, you move to stage 4 of catastrophic coverage, where you pay the greater of 5% of the drug cost, or $3.60 for generics, or $8.95 for brand name drugs. You remain in this stage the remaining of the year and it resets January 1st of the following year. Now let's look at option 2, which is Part C of Medicare, also known as the Medicare Advantage Plan. These plans have been around since the 90s and have become very popular due to the saving potential for many beneficiaries. The Medicare Advantage Plan is offered by private insurance companies and funded by Medicare. Medicare pays the insurance company to administer all parts of Medicare. These plans cover Part A, Part B, and Part D of Medicare. Some also include additional benefits that Medicare does not cover, like dental, vision, hearing, etc. Those additional benefits can be helpful. Original Medicare would no longer be the primary payer. The insurance company would cover everything Medicare covers as good or better. Many plans have a zero monthly premium and you would only pay some co-pays for services. The insurance companies usually offer HMO or PPO options, so there is a network of doctors to choose from to get the best cost. We make sure you get a plan that your doctor will accept. If you are looking for this type of option, we will do a comparison of all the plans and make sure you get the right plan for your needs. This is a more in-detail version of the Medicare Advantage Plan, where you can see all the additional benefits that it will provide. Most of them provide vision exams and eyewear, preventive and comprehensive dental coverage, hearing exams and hearing aid coverage, free over-the-counter health products, fitness membership, routine foot care, free meals, transportation for medical appointments, chiropractic and acupuncture, massage therapy, and worldwide emergency coverage. So now hopefully this chart makes more sense. Option 1 involves staying on original Medicare and buying a Medicare supplement and Part D drug plan. This gives you the most flexibility with doctors but comes at a price. Option 2 takes you off original Medicare and involves a private insurance company handling all of your Medicare benefits. Many have no premium but do have copays as you go with a maximum out-of-pocket to reduce your risk. Based on what we have discussed, think about what option would work best for you. Okay, next. Medicare doesn't cover everything you may need for healthcare. These are other programs available to help reduce your costs for care in particular situations. Medicare doesn't cover custodial care, which is help with activities of daily living. This is what long-term care or short-term care insurance would help with. If you select a Medicare Advantage plan, there are hospital indemnity policies for usually little expense to cover the hospital copays associated with the plan you choose. One of the biggest expenses that can happen is with cancer chemotherapy. There are very inexpensive policies that can provide you the money you need to cover your care. Original Medicare doesn't cover any dental or vision coverage except in rare situations, so a separate policy can be purchased for that. And lastly, do you have any coverage for burial expenses? There are affordable options available to provide you from $5,000 to $25,000 worth of coverage to help your loved ones cover your expenses for burial. As you can see, there are a lot of moving parts and everyone's situation is different on Medicare. There are many options available and it takes the right person to make sure you are in the right plan with the right coverage for you to pay the least amount of money out of pocket. Please reach out to me for any questions, and if you want to do a personal comparison of plan, please feel free to call my number, which is 818-635-8221, or you can go to my website and fill out my contact form information. We can set up a time that is convenient for you. My website is honesthealthcaresolutions.com. And that is it. I hope that the information you received in this video was helpful and made Medicare a little less confusing for you. If not, please give me a call and I will go over any questions you may still have. Thank you for your time and for trusting me with your Medicare needs. I'm looking forward to hearing from you soon. Thank you.